Hello, Facebook world. How are you? Hi, I'm McQueen, MD, emergency physician and travel doc. I wanted to start a Facebook Live series, and it's 3 o'clock p.m. Eastern Standard Time, and I'm just going to wait and see if anybody joins me. Get my lighting, sitting here outside. Beautiful day. It was storming a little bit earlier, but it's a beautiful day right now. So I just wanted to see if anybody was going to join me. Uh, if you have questions, feel free to post them, or you can post them later. So I'll wait a few minutes, enjoying the heat and humidity that summer brings us. But thank God I'm alive. That's what I say. It's a good thing. It's a good thing. Yes, it is. Okay, let's see. I've been live for I'm going to give it 45 more seconds and see if anybody comes in. Then I can start if anybody wants to grab the recording later, they can. I know it's in the middle of the afternoon, but that's why we record things and post them, right? And also, I'm a night shift doctor, and I am usually up about this time in the afternoon. So at nighttime, you might have caught some of my 3 a.m. postings while I'm working or insomnia. You can check those out. So let's go ahead and start. All right. My name is Yvette McQueen, MD. I'm a global physician on a mission to educate about health, travel wellness, and disease prevention. Emergency medicine, physician, and travel doc. I teach people and give about travel, health, and safety tips, along with travel consultations about international travel. So this, I decided to do a weekly series on thoughts from an emergency physician. A couple, you can catch it either on my Facebook or my Google or my Google Plus or my YouTube. I spoke about if you have emergency, what to do when you go to ER. And sometimes the nurses and doctors, imperfect action. I forgot to turn that off. Okay. So sometimes the nurses and doctors sit around and we say, man, I wish we could tell our patients to do such and such and such and such. Or why don't the patients know about this? So these were thoughts that had occurred and we want to tell the public. So that's what I thought I would give, little tips about that. So the weekly series will include just random thoughts or things that have occurred that people should know. When I was growing up, it used to come on TV. It used to be called PSAs or public service announcements, and they would be like 15 seconds or 30-second blurbs for unpaid commercial. But now, everything has to be paid, so they no longer have PSAs for people. So, okay. So I'm talking about today, what is an emergency physician? So a lot of people come to say, oh, you're a doctor. What's your specialty? I'm like, I'm an emergency physician. Well, what does that mean? It's like I work in ER. But are you like a primary peds or what do you do? So people need to know what emergency physician. So emergency medicine is a specialty. Just like if you see a surgeon or orthopedic or cardiologist, emergency medicine is a specialty. So we are board certified specialty, and we train in everything. So anything that can roll through the ER door, we should be able to handle. So we go to medical school, and after medical school, it's a 3-year training process in emergency, and we learn everything from cardiology to delivering babies to pediatrics to lacerations, of course, trauma, how to take care of traumas, different procedures, airway. We deal with people's breathing, codes. See my hands, everything. Let me back up so you can see my expressions. Everything. So that's what emergency medicine physician. Some of us get even more specialized, where we could just do pediatrics, or there's now what we call the geriatric emergency physician that only deals with the senior citizen population because they had their unique medical problems and medical situations that need to be taken care of. There's emergency physicians that work in university settings, or they at community hospitals that most of you are probably familiar with. And then there's emergency physicians like myself that travel. And the reason I call myself the travel doc is because what I do is I travel around the United States and I do fill-in shifts. So when people, it's called locum tenens. So it's Latin for temporary position. So when people are absent due to illness, maternity leave, family leave, what else can it be? Companies take over. That's when I go in and I do the fill-in shifts at an emergency room. So I may fly to a hospital next week and work 3 or 4 days and fly home. So that's why I'm the travel doc. But I do work in emergency that deals with adults and pediatrics. I cover it all. And so we cover it all. So some of the things emergency physicians want to tell their patients when they come in the emergency room. Don't lie to us. We don't like it when our patients lie to, you shouldn't lie to God and you shouldn't lie to your doctor. Okay? Anybody else, that's on your conscience. But just be upfront. Tell us what's going on. That way we can help you. Maybe instead of going through some full details and drawn out process, we can get right to the problem. So that's one thing. We also wonder, Monday. I decided to do this series, like I said, on Monday. This is going to be a Monday afternoon series. I work night shifts. I've worked evenings and mostly nights, but some evenings for the last 16 years. And I just love working after hours. But Mondays can be our busiest time. People wonder why Monday is a busy. Everybody say, "Oh, well, I think Friday nights or Saturday nights in the emergency room is busy." It can be, and it cannot be. But it has been recorded that Mondays are the busiest time in the emergency room. And you want to know why. Why is because people have waited all weekend long with whatever was bothering them. So something came up Friday night or something came up Saturday, and they waited and waited. And they say, "Oh, well, I finally need to go see what is wrong." Or they call their doctor's office Monday morning, and their doctor is so packed on Mondays that they say, "I can't take it, but it sounds serious. Please go to the ER." So that's, let me turn this. I see a little shadow on this side. So let me see if that helps. Okay. So they say, go to the ER. And that's so they end up sitting in the ER. Or, and be honest with you, someone was sick over the weekend. They were sick Sunday, didn't make it to work. So they're like, "Oh, I need a doctor's note." So they need to go to the ER. Let us know up front. That's how we won't go through a long, drawn-out process of trying to figure out what's wrong with you. If you're telling us, I was sick this weekend, I had a virus, I was throwing up, we may do some initial things, but yes, let us know. That's what you need, a doctor's note. And also another thing is, why don't people like to carry ID on them? We get people either in car accidents or have passed out. Say you're out running in a park and you pass out and you don't have ID on you. You end up coming to us like as a Jane Doe or a John Doe. And we, until we can have somebody identify you, which is becoming harder and harder because of some of the privacy laws. So please carry ID on you. That's very important to us to know the patient we're taking care of, because we can locate your family, locate medical problems. If you have a medical condition, you probably should get some type of medical, either necklace or a bracelet saying you have hypertension, diabetes, something to let us know a typical medical problem. So you should let us know that. So carry ID on you so that we know what's going on. Now, one thing is the invention of the phone. It's amazing that people will carry their phone no matter what, but they won't carry ID. So I was supposed to pull this up. Let me see if I can pull it up. What happens with, I know it's on Apple phone, and I think it's on Android phone too. I showed somebody on Android. Let me close this up. So if you fill out the health portion on your phone, and then when it comes up and it's locked, let me get my unlock here. If your phone is locked, we no longer have to go through the whole ordeal of trying to unlock it, blah, blah, blah. Okay, where's my camera? Let's see. So if you can see this, when your phone is on lock, it has a button down here that says emergency. Right here. If you touch that, it ends up saying medical ID. Let's get to the camera. There we go. Medical ID. See at the bottom, medical ID. So I started off with, we get somebody's phone is lock keypad, and it'll say medical ID. This is the Apple one. I can't remember what it says on Android, but it's also about the same. And if you've put your health information in there, put your name, contact information, contact in case of emergency. It also lets you put in your medical conditions, your medications, your allergies, which we need to know. So if you're found or you're in an accident and we find your phone, we can actually, let me see if I can pull that back up again. We can actually find out that information without unlocking your phone. And no, okay, so once again on the Apple, it's there. This is the lock screen, okay? And then down here is the emergency. I tap on the emergency and it says medical ID. And then it comes up with the information. I won't show you all my information, my contact, but that's the medical ID that we find, okay? So that's helpful. Like I said, nowadays, people will carry their phone no matter what, but we can't find ID on them, and that makes a difference. So this someone on here, you got any questions? So this is just thoughts for an emergency physician. I told you, like I said, a couple weeks ago, I put what to do if you come into the emergency room, things you should expect. When you call the emergency room saying, oh, well, I heard my friend is in there and it's such and such name. If you call the emergency room, you can only get so much information. You can get yes, no, they're there. That's it. We cannot tell health information. We can't even tell if it's an adult. We can't even tell that to the parents. So if I'm calling about my adult child, they won't get any information. But if it's a minor, we try to bring the parent in. It's something called HIPAA. The healthcare professionals are trained about it every year. It's a federal law. It's a privacy of patient information. We cannot give out your medical information to anyone unless you allow it. So when I go into patients' rooms, I usually, if other people are there, and I usually say, is it okay to talk in front of them? And if they say no, you need to leave. Please do not be offended if we ask you to leave the room, because they don't want to share. They don't want to share their private information. They will share it when they're ready, even if it's a husband or wife. We can't share it with you unless they say it's okay to share it with you. That is the law, and we must abide by it. So if you call on the phone and then you say, oh, well, so-and-so came in an accident, and they're my neighbor, how are they? They're here. We can say they're admitted in the hospital or they're no longer here, but that's all we can tell you. If you also call the emergency room seeking advice, because of laws and malpractice, we cannot give advice over the phone. The best thing is to, if you have a primary care physician, to call that doctor. Usually they have an answer machine or a nurse line. A lot of the insurance companies, too, have nurse lines. So you should try giving that a call. Or if you had a procedure done, you just had surgery and you were discharged from the hospital. It's amazing. People have surgery and they're discharged from the hospital and they call the emergency room. They like, bother them. But they're the doctor that actually performed surgery on you. They were inside your body, basically. So please, you can call your doctor, you can call your surgeon. And if it's after hours, they do have answering machines or answering services, or like I said, nurse lines. Ask a nurse, ask a doctor. Most insurance companies have that now. Even some insurance companies are using telemedicine. So think about this. Some insurance companies will have you call a number to speak to a physician over video, just like me. See, you can actually talk to a doctor over the internet for minor problems and see a doctor that way without going to the emergency room. So that's another consideration is telemedicine. But if you want advice, you're calling about advice. Unfortunately, we cannot give advice over the phone if you call the ER. All we can really say is, if you feel it's an emergency, we'll be more than happy to see you. Yeah, that's a canned line. If it's an emergency, we will be more than happy to see you. So come on in. No, we don't know how busy it is. No, we don't know how long it's going to take. But we'll be more than happy to see you. So unfortunately, that's it. So if I see one person on, and I don't know this, but one person is on. But if you have questions, I will be doing this weekly. I'm going to go on here. Fortunately, when you're on the computer, it doesn't show who's actually on live with you. So, but if you have questions, let me see if I can pull it up over here. You can type in your questions. I'm more than happy to answer them. Or you can always type them in and I will answer them later. So it says I have two people on. Say hi. I don't see what two people are on, but you can just let me know you're on. Now it's just back to one. So Oh, it's Jennifer, Dr. Cottle. Hi, Dr. Jennifer. I was talking about what is emergency physician. Just a recap. Explaining what an emergency physician, our training, and just some thoughts that we think people should know about coming into the emergency room, what doctors are saying. I'm just gonna each week tell random things that happen. Make sure you fill out that information. It says my broadcast was interrupted, but I still seem to be going. So make sure you fill out that information on your phone, your health information. Each week. Oop, didn't want to hear that live. Oh, that's an echo. And imperfection, imperfect action, remember, but we're still hanging in there. Fill out your phone for your mental health information, and it will show up if we. Sorry, I get interrupted. I'm hearing thunderstorms, and I don't know if that's interrupting my internet or not. It shouldn't. It's supposed to be a high-speed internet. It shouldn't. But I would be here every Monday afternoon because I work night shift, so it will be the afternoon, Mondays at 3 o'clock p.m. Next week, join me next Monday, and I will be discussing medications, taking medications, proper use of taking medications, prescriptions, and also discussing the opioid epidemic, which seems to be a major topic of lately. So I am Yvette McQueen, MD, a global physician on a mission to educate about health, travel wellness, and disease prevention. You can find me here on Facebook, Yvette McQueen, MD, YVETTEMCQUEEN, MD. And I will be coming up soon with CPR first aid demonstration on YouTube and webinar series. So look for that. Stay healthy and well. Ciao.